What is a lumpectomy and how does a pathologist examine a lumpectomy? I'm Dr. Wolf, I'm a pathologist, and this is part of my ongoing series on breast cancer. For a little context, you may want to watch the previous two videos on breast cancer that I made to see where we are by this point. So, by this point, we've had a core biopsy done, cancer has been diagnosed, and now the surgeon is going to excise the lump and the tissue around it, and that's why it's called a lumpectomy. It is a surgical removal of the lump. Now, at the time the core biopsy is done, the radiologist will put in a metal clip. You can see that metal clip right there, and that marks where the tumor is. This also helps with needle localization, and that's what that is right there. That is actually a wire localization where the surgeon knows exactly where the tumor is and can cut out around it. Once they cut it out, it comes to the lab looking like this. Sometimes the surgeon will ink it, and other times it will be uninked, and the pathologist will ink it. Now, why do we ink it? Well, each one of these colors represents a surgical margin. This is a video of me actually going through this, but for some reason I cannot get the video part to upload here, so we're just going to do it as a still image. In this case, the black is actually the anterior margin or the skin margin. And then each one of the colors represents like the superior margin, the inferior margin, the lateral margin, the medial margin, and the posterior or deep margin. And so what happens is I will cut through this, pathologist will cut through this, and will submit these margins, at which point we will see if there is cancer at the margin when we look in the microscope. If there is cancer at the margin, the surgeon will know which margin to go back to cut a little more out, and that's what the color is. So under the scope or in the scope, if I see red and I see cancer going up to the red ink, I know that that margin is positive. Now, what happens is that lumpectomy specimen that I received, I will actually go through and I will cut in such a way that represents all of those margins and the tumor. We put those into these cassettes, which are then put through for histological processing. This is just a close-up of the tissue once I've cut through it, and you can see that there is a hole in each one of these, and that corresponds to the area where that metal marker was. So if you have a look here, you can see that that metal marker was right in the middle of this dense tan white looking area. That's the breast cancer right there. And you can actually see where it transitions from cancer to back to the normal breast here, and then the inked margin. So once the tissue is processed, it is stained, and then the pathologist can look at it in the microscope, and that's what this is. All of this up here is breast cancer. And you can see this is the margin we were talking about, where you've got that tan white dense area where all the cells and fibrosis is, and then that yellowish area is actual fatty tissue. And I made a magnified section here so that you can see that this is all cancer. And as we move over here, this is normal fatty breast tissue. So what you can see here is the cancer invading the normal tissue. And sometimes there are just a few cells there. That's why the surgeon has to take a margin of normal tissue around the cancerous lump. So at this point, the pathologist will produce a report with the diagnosis, making sure that it matches with the core biopsy diagnosis. And if there's any addition, sometimes the core biopsy diagnosis will show you one thing, and the full excision, you will see more pathological features, more types of tumor in there. And then also, we're going to comment on the margins and do the grading and staging of the tumor. If you have enjoyed the videos so far, please consider following the page if you don't already, liking, commenting, or sharing the videos with someone you know that may be interested in this.